நோய் நாடி நோய் முதல் நாடி அது தணிக்கும் வாய் நாடி வாய்ப்பச் செயல். நோய் இன்னதென்று ஆராய்ந்து நோயின் காரணம் ஆராய்ந்து அதை தணிக்கும் வழியையும் ஆராய்ந்து உடலுக்கு பொருந்தும்படியாக செய்ய வேண்டும். With that, hi there, happy morning everyone. In this module, we can learn about kidney stone. The other terms used for indicating kidney stones are renal calculus or nephrolith. This condition is known as nephrolithiasis, urolithiasis or urinary stones. Actually, what is kidney stone? A kidney stone is a hot solid piece of material that forms in a kidney when substances that are normally found in the urine becomes highly concentrated. This is the crystals of minerals. Kidney stones are one of the most common disorders of the urinary tract. Over 1 in every 20 people develop kidney stones at some point in their life. There are different types of kidney stones, but nearly 80 to 90% of kidney stone is formed due to calcium stones, where calcium stones is of two. One is calcium oxalate, while the other is calcium phosphate. Here, the positively charged calcium ion binds with the negatively charged oxalate. As a result, black or dark brown color salt is formed where acidic urine is excreted. Similarly, positively charged calcium ion binds with the negatively charged phosphate ion. Dirty white salt is formed. As a result, alkaline urine is excreted. They may range from very small particles, often called sand or gravel, to giant staghorn calculi. Cystine stones are formed due to the leakage of amino acid cystine, which leads to the formation of yellow or light pink stone. Followed by that, uric acid stone. Uric acid releases proton. As a result, urate ion is formed and that binds with the sodium, forming monosodium urate that crystallizes to form uric acid stone. And this is due to increased consumption of purine-rich food like lobster, so and so. Struvite stone, which is also known as magnesium ammonium phosphate, that is mainly due to bacterial infection. The most common bacteria involved in this type of stone formation is Proteus vulgaris or Proteus mirabilis. This bacteria act on urea with the help of enzyme urease, where urea is converted into carbon dioxide and ammonia, where ammonia makes alkaline secretion of urine. Followed by that, here are the pictures of stones: magnesium ammonium phosphate or struvite stone, calcium phosphate and calcium oxalate. The major causes for urine stone are oxalate, uric acid, phosphate, sodium, potassium and calcium are in increased level in urine, which causes either acidic or basic condition of urine. Clinical manifestations of kidney stones are severe flank pain, abdominal pain, nausea and vomiting, fatigue, elevated temperature, blood pressure and respiration, steady pain, pain on urination, pink, red or brown urine, oliguria, oliguria which is nothing but decreased amount of urine output, and anuria in abstraction, which means less than 100 ml of urine is excreted, the kidneys stop producing urine. Hematuria, the combination of blood in urine is hematuria. Renal colic, hydronephrosis. The risk factors are maybe due to a genetic problem or family history, hypercalciuria, increased calcium, cystic kidney disease, hyperparathyroidism, renal tubular acidosis, dehydration from low fluid intake, high dietary intake of animal protein, Crohn's disease. Signs and symptoms. Sometimes the kidney stones may not produce symptom, and such stones are silent stone. The main symptom is severe pain that starts suddenly and may go off suddenly. Pain may move to groin area or testicles. We have many facilities to remove these kidney stones. They are pylolithotomy, where removal of stone from kidney pelvis. Nephrolithotomy, a incision into kidney for removal of stone. Nephrectomy, a removal of kidney, indicated when kidney is extensively and irreparably damaged and is no longer a functioning organ. Partial nephrectomy sometimes done. Ureterolithotomy, a removal of stone in ureter. Cystolithotomy, a removal of stone from bladder. Prevention of recurrent stone formation. For patients with calcium oxalate stone, must avoid excess of calcium and phosphate-rich diet. Maintain low sodium diet. Teach the purpose of drug therapy, allopurinol therapy to reduce uric acid concentration. For patients with true white infection, teach signs and symptoms of urinary infection in patients with neurologic or spinal cord disease. Teach the use of dipstick to evaluate urine for nitrites and leukocytes. Encourage him or her to report infection immediately because true white is due to bacterial infection. Try to avoid prolonged periods of recumbency, slows renal drainage and alters calcium metabolism. For patients with cystine stone, occur in cystinuria, hereditary disorder of amino acid transport. Teach patient to alkalize urine by taking sodium bicarbonate tablets to increase cystine solubility. Instruct patient how to test the urine pH with a pH indicator. Try to avoid these foods which are rich in oxalate like strawberry, chocolates, coffee, and so and so. These are the surgical methods used to get recovered from kidney stone. The first one is shockwave lithotripsy. Here, the high energy shock waves are transmitted where the water is filled to break down the stone with the help of high energy shock waves of water. General anesthesia is given for this method, and this is extracorporeal shockwave lithotripsy method. Followed by that, ureteroscopy, where the small instrument ureteroscope is inserted to ureter to bladder, where kidney stones are broken by the laser fiber. And followed by that, percutaneous nephrolithotomy, where a little small hole is made at the back and the instrument is inserted into your kidney with the help of X-ray guidance, and that breaks the kidney into small pieces, and that small pieces of stones get excreted through urine. And this is ureteroscopy method. After doing this, stent replacement is done, which is used to drain the urine. After such procedures, in order to make the ureter comfortable and to feel ordinary, this stent is inserted into the ureter. That is a soft hollow tube which is flexible, which will be inside the ureter for weeks or even for a month in order to make the ureter comfortable. Under the guidance of X-rays, percutaneous nephrolithotripsy is done to break the stones. For many patients, a stent can cause irritation of the bladder and ureter, which can cause these symptoms like cramping, discomfort, and back pain when you urinate, blood in the urine, frequent urination, urinary urgency, bladder pain. After percutaneous nephrolithotripsy, people may feel discomfort, flank pain, bruising, nausea and vomiting, and blood in urine. In order to dissolve kidney stone and keep your body hydrated, consume or take more water. Avoid calcium-rich food. Home remedies for kidney stones. Avoid foods with vitamin D, antacids, and calcium base. Have fresh, ripe apples, melons, and grapes. Avoid eating meat products, poultry, and fish. Drink plenty of coconut and barley water regularly. Eat well. Stay well. And finally, மருந்தென வேண்டாவாம் யாக்கைக்கு அருந்தியது அற்றது போற்றி உணின். முன்னுண்ட உணவு செரித்த தன்மை ஆராய்ந்து போற்றிய பிறகு தக்க அளவு உண்டால் உடம்பிற்கு மருந்து என ஒன்று வேண்டியதில்லை. I feel this would be an informative video. This is your future zoologist signing off. Thank you. Have a